Hello, I am Dr. Parul Shukla, pediatrician and neonatologist practicing in Thane since past 22 years. And today we are here to discuss the topic febrile seizure. Now, when it comes to handling emergencies in the house, it's a skill, it's a reaction time, how you handle, and often we are not prepared for it, right? So that is something which we are lacking, and I'm sure this video will help you handle and train yourself to help someone or your own child with, God forbid, if the child gets a seizure during fever. During fever, the child's brain is vulnerable to getting a convulsion or a seizure, as we say, or fit, as we say in the common colloquial language. Now, what happens is there is a spark in the brain, and then because of the disturbance in the metabolism, there is this convulsion, that is, this tonic movements of the hands and feet. They can at times be complete or incomplete, that is, the entire body may show shaking movements, or only the hands may move, one side may move, right or left, depends. Either only the mouth may show some twitching movements the way I showed, or they may show like this, that is, blinking of the eyes. There may be some frothing, or the child may just go blank like this during the fever. All this happening during the fever because of the immaturity of the brain is called as febrile seizure or febrile convulsion. The age group that is affected in this condition is from 6 months of age to 6 years of age. The reason it is called a simple febrile convulsion is that it does not leave behind any sequelae. Therefore, dear friends, do not be so depressed that if the child gets a seizure during fever, take it positively, this is going to go away, and it is not going to leave behind any problems with the child's brain, IQ, behavior, or any school performance. How do you handle it is what we are going to see in this video. So let us see what are the don'ts of it. First and foremost, don't try to pounce on the child to stop the convulsion, because by touching or forcing, by holding the child's hands and feet, you are not going to be able to control the convulsion. Rather, you will break the bones of the child, because this child's body is vulnerable, and by your force you may cause some harm, sprain, or any fractures to the baby's bones. So please do not try to force stop the convulsion. Please do not try to go and bring onions and chappals to see that smell, the child smells it, and that offensive smell is not going to stop the convulsion. No water or any food particle should be given into the baby's mouth, because that is not going to stop the convulsion. Rather, you will cause choking and you will cause harm to the baby. Therefore, please do not try to feed the child or put anything into the mouth. The first thing that you need to do, having calmed down yourself, put the baby into this position as we call as the recovery position. So therefore, the baby should be kept on any side, either left or right side, whatever is convenient to you most at that time. Put the baby on this side so that whatever secretions from the mouth come are drained outside and the baby does not swallow those secretions. Keep the baby in a comfortable position and unloosen the clothes or loosen them, the buttons, so that the child is comfortable. Try to wipe out the secretions, that whatever you may see. Do not try to put your hand into the mouth, because the child is having an active convulsion, the child is going to bite yourself. Please do not put a spoon or any other object into the baby's mouth, because you are going to cause more damage to the baby's mouth, and there may be trauma and bleeding, which will aggravate the problem. And as you have seen that there is a high fever, the first aid that you can do is give a suppository. Paracetamol suppository is available in the market. Then this is the protocol that you have to follow. Having given the paracetamol suppository, you can also give the child midazolam nasal spray to put into the nostrils, both the nostrils, which will control the convulsion for the time being. If it controls the convulsion, fair, else immediately take the baby to the hospital. I hope these tips would be helpful to you, and so you can manage the emergency better in the house, and you are more equipped than before. Thank you so much. God bless you.